Welcome to another episode of Speaking with the Senator. I'm Senator Kevin Avard, and today we have an interesting topic. It's about copay accumulators, and I practiced this a number of times. And as it's hard to even understand the concept at this point, but it's something that's very new to me. PBMs and copays and just a whole host of issues that are plaguing our country because we don't know what they are and we don't know how we can benefit from them or how we're not benefiting from them. Issues that affect us all as far as in the healthcare industry with insurance and what does what are we covered for? So we have some interesting guests here. We have Mike Rollo from the Cancer Society and Susi and Scott. And I want to welcome you all to talk about this particular topic because we have a Senate bill that's coming up. Senator Innes has a bill to talk about this very thing. And I've never heard of it before, even though I'm a co-sponsor. But when I heard about what it does and how it can help people, if we can remedy what's going on, we might be able to save some people some money, right?
We certainly can, Senator. Thank you for having us today. We appreciate it. As you said, yes, I'm with the American Cancer Society, and I have the pleasure and honor of leading a coalition of 17 other organizations that are public health and chronic disease organizations that have come to the Senate to ask them to prohibit a practice that you started to describe, that an insurance practice that we find objectionable, that we feel is unfair to the patients that we represent, and that I'd like to describe to you a little bit, if that's okay.
Sure. Before you do,
Sure.
Does this affect people that are on Medicare and Medicaid?
No, it's for private insurance.
Okay.
So, this is for people with private insurance. So, whether you have cancer, I mean, from my perspective, a cancer organization, but whether you have cancer or cystic fibrosis, multiple sclerosis, hemophilia, arthritis, any chronic condition, really, when you get that diagnosis, it's really a gut punch, and the what you want to focus on is getting better, or managing that condition if there isn't a cure.
Right.
And how are you going to manage that condition? It's through treatment. And how are you going to get treatment? You're going to go to your doctor. Doctor is going to prescribe that treatment. And in some cases, it's a prescription. Now you say, fine, great, I've got insurance, not a problem. You get your prescription, you go to your pharmacy, they say, okay, well, Mike, you've got a $500 copay. Like, okay, well, you knew that's part of your plan. Say, well, that's an awful lot of money.
Right.
But I have insurance, and I knew that was part of it. Well, okay, I can't afford $500 per month for my copay, my out-of-pocket cost. But, so you talk to your doctor, you talk to your pharmacist, and they say, well, do you belong to a church? Like, maybe they can help you. I'm like, well, yeah, maybe, but I don't know if they can. Well, you could do a GoFundMe. I'm like, I don't know, maybe. Well, there are charitable foundations, maybe they can help you. Even some of the manufacturers themselves, they have programs they can help you. Okay, fine, well, let's figure it out. So let's just say, for sake of argument, that the prescription you need, the manufacturer that makes that drug, they have a program. Like, great. You sign up, you qualify for it. Terrific. I'm a round numbers kind of guy. So let's just say, we said $500. They're going to give you $350. You're still on the hook for $150. So you still have skin in the game. So
right.
you're
Sure.
still on the hook for some money. And, for a lot of people, that's still a lot of money. But you say, look, I got to figure this out. I'm going to do that, right? So you do it. You get your $350. You go to the pharmacy. That's in the system already. They've got it figured out with the pharmacist. And you take your $150. You go out into the pharmacy. You pay it. Pharmacist takes a pill, vial, puts it in the bag, staples it with little instructions, hands you your bag, right? Just like any other time you go to the pharmacy, they say, thank you very much, you go on your way. You think you're all set. You might very well be. There are some plans, though, however, some people in this state have certain insurance plans. They may not know this until it's too late. They have a plan that will say, well, not so fast. that $350 that you just got from whatever source it was, doesn't matter, it doesn't have to be from a manufacturer, it could be from anyone, that doesn't count towards your out-of-pocket maximum per year.
And why?
Well, we'll get to that in just a moment, but that doesn't count. You're still on the hook. Well, you get your pills, that's great, but that doesn't count towards your out-of-pocket costs. You're still going to need to meet that $350 eventually towards the end of the year. So in essence, they're really, double dipping. They're getting paid twice. And they'll say, well, you ask the question, well, why? They will argue, well, this is to help offset future premium costs. And I would...
Is this when you blow a gasket?
My organization and the 17 other organizations would say, well, that's not fair. I would say as an individual, I have never seen my insurance premiums go down, ever, regardless of what company I've had.
No.
And, there was a study done by the Pioneer Group recently that has shown that in the states that have passed the prohibitions like we're asking for, that's in Senate Bill 354, they have done studies that show statistically there is an insignificant increase in premiums in the very states that have passed these prohibitions. So I will leave it to your viewers to draw their own conclusions as to why these practices are put in place, but they're certainly not doing anything to help patients.
And the whole idea of insurance is to share the risk.
Sure.
That is the bottom line. Mm-hmm. But it seems like this kind of grabs a certain section of our population to basically, subsidize the insurance company. So, but I would blow a gasket.
Well, and these people, let's be honest, these people need to be focused on getting better.
Oh, absolutely.
They have insurance. They've been paying their premiums, and they don't know that they have this benefit afforded to them as part of their policy. And we have two folks here joining us today that can speak to this because they have real life experience.
And it's called the copay accumulator, right?
Correct.
Susie, welcome.
Thank you.
Yeah.
I'm Susi von Oettingen with the New England Hemophilia Association. And my son has hemophilia, severe, so he has a condition that is not curable. It's chronic. He's had it all his life. It's genetic. And needs medication on a regular basis so that he can basically live a life the way you and I can without fear of being hospitalized constantly. When he was little, he was not on prophylaxis, which means he would get the medication before anything happened. And we ended up in the ER every 3 to 6 weeks for infusions, and then there would be day-long infusions of this medication. Yes. So no high school sports, no Little League. Well, Little League, yes, but it was nerve-wracking. But now he's on prophylaxis. He gets this medication and takes it regularly, which is great, for he's 26. But he just aged off my insurance policy. And I had a good one because I worked for the federal government. So as you said, it spread the risk. So our policy was quite good. We did not use copay assistance, which Mike was talking about, because our copays were low enough and we could afford it and, leave that money for people who can't afford it. Well, now my son is on the marketplace. And it took weeks to pick a marketplace insurance policy for him. It starts next 3 weeks from now.
Is it a group plan or individual or?
It's individual because he works for a company that does not have an insurance coverage. The experienced broker he went through, a really great woman who tried her darndest, had never heard of copay accumulator adjustment programs. Didn't know what it was. So she was educated by my husband. Then he called up the it was 2 companies, 3 policies that seemed to fit our son the best for his chronic condition. Neither company admitted to having an accumulator adjustment program. One of them did say, though, that if you get copay assistance, we will not count it towards your deductible. But they would not call it an accumulator adjustment program. So if you ask somebody if they have it, they'll say, well, we don't know about that. We don't.
But isn't the first question, so how would they know?
That's a good question. And so here's the other issue, and I think Scott can address that as well. We have been going through a hemophilia treatment center, which is government funded in small amounts, but that allows patients to have a full care for everything from doctor to nurse to social worker to physical therapist. And we get our medication at a reduced cost through their pharmacy. Well, now, under the new policy, we may not be able to use the treatment center. They recommend the pharmaceutical company, and they say, we'll get the bill. So they'll know what we paid versus what someone else may have paid.
Okay.
They get the bills. So they have this connection, and maybe the hemophilia treatment center specialty pharmacy would be required to send them that information as well. But my understanding is, we don't get a check. It does not come to us. It goes straight to pay that bill. And so there must be compartmentalized, and they see that someone else paid a portion. Is that correct, Mike?
And Scott, what's your story?
Excuse me. Well, I'm similar to Susie. My oldest son has hemophilia. Again, it's a lifelong condition. He needs to take his bleeding factor to when he has issues. He's not on prophylaxis, needing to take it every week because he has what's qualified as moderate hemophilia. But if he has issues, then he needs to get the medication, and it's very, very expensive. It's a small pool of folks, and so anyway, his first experience, or our first experience with this, was when he was in college, and he had a delivery of factor that came from his hemophilia treatment center, and had a particular cost to it, and the company that provided that medication to him had a co-pay assistance program. So you could go to them and apply, and if you were at a certain income level, which he met, low-income college student, easy to meet that level, and they would pay up to $12,000 a year. At that particular time, that was the program. They would pay up to $12,000 towards this medication. Wow. Now that seems like a lot of money, but when you think that he needed, on a typical injection, maybe 8,000 units at $1.50 a piece or whatever it is, you're looking at a $50,000, $60,000 bill. So insurance would cover their portion and said, here's what you owe. He went to the accumulator adjuster, he went to the copay assistance program. They paid that money, but that's when they revealed that this does not count towards your deductible. So any insurance payments that you have coming up, you still have to meet that deductible. So in reality, they get paid twice.
Is a kick in the gut.
So they get paid by one company, but that doesn't count. And so we just see it as an issue of fairness.
What is the reasoning behind the insurance companies doing this practice?
We've heard a number of things. One, I think, and I want to say, first of all, just say to Mike, thank you for leading this coalition of groups and helping us pull together, because together we're way stronger than we are alone.
Did you help with Senator Innocent with the language on this?
We did, yes. We did. We were happy to do that. And I think it's important, and first of all, thank you to Susie and to Scott. I mean, it's important that folks understand that this is, first of all, affecting real New Hampshire families.
Right.
This is not an abstract problem. This is affecting real families right now in real time in New Hampshire. And that it's not one disease specific. It truly affects a whole spectrum of folks. It respects no boundaries. I mean, it's an insidious practice, and it needs to stop.
And it's really not looking for a handout. It's looking for those that are able to help out in assistance. They're just being very kind and helping out. Instead of it actually working, it's being grabbed in the name of we're going to reduce premiums from that. And we're going to have another show on PBMs, which is my bill, 555, SB 555. And that's another situation where grandma and grandpa seem to be subsidizing the insurance companies because That's another show, so you have to watch it.
Tune in later.
We
That's
will.
right.
Later. Film at 11.
I think you could have several shows on the practice of the PBMs.
Yeah.
But you had asked, one another thing we've heard from insurance companies is that we want the patient to have some skin in the game.
Right.
If their benefits are being covered or paid, their copay is being paid, or their deductibles being paid by some other organization, then they'll be able to then just choose a more expensive medication.
their illness is good enough,
there
it's
isn't
skin
a
enough.
more expensive medication available. We have what we have. We can't get anything
So
cheaper.
what in essence does the bill do as far as addressing this issue?
Well, the bill quite simply just prohibits the practice. They will not be able to say that the assistance that these folks are getting does not count towards their out-of-pocket max per year.
So if it passes the Senate and the House, and it gets signed into law, will insurance companies leave the state?
I can't. No, that has not been that's not what has been seen in other states. No, I can't imagine.
Okay. But there might be a scare tactic is to say, well, we're going to end up raising premiums.
I have had the honor and pleasure of working in this state for the American Cancer Society for the last 13 years. I have sat in both the House and the Senate Commerce Committees for all of that time, either waiting for bills that are mine and listening to other hearings on all sorts of insurance bills. And that's what they say on every single insurance reform. And I have yet to see any of them leave yet.
That was kind of whispered in my ear on the PBMs. Well, Senator, if we do this, we might have rate increases. Well, show me where it's happened.
Well, listen.
And it hasn't. Mike mentioned earlier, actually, that there's been studies, and
Yes.
Susi and I, and part of the hemophilia community, there are people from around the country that we are connected with who are dealing with these same kinds of issues. Mm-hmm. And in the states where an accumulator adjuster ban has been enacted, there has been no evidence that it has raised premiums or caused
They go up
people
anyway,
to go.
so it's...
Right, they're going to go up anyway,
Right.
but not because of this practice being
Is this
taken
almost
away.
like a type of gouging?
As you could put it that way. I mean, I would say it's just a very unfair practice, taking advantage of people at their lowest point,
Right.
when they need to be focusing on either getting better or just managing a very severe condition, and they don't need to be dealing with this.
So one question about those people that are trying to help with assistance, do they find out, hey, well, this isn't really helping?
I think it depends on where that funding is coming from. I think the pharmaceutical companies know all about it because they're hearing about these.
Right, but nobody wants to just throw money away if it's not
programs.
going to count.
Well, there's a couple of things. I think looking at my son, who's 26, and he's going to be on his own, if he finds out he can't afford it, like he's not getting the assistance, then he's going to put off
Right.
using that factor. He is going to make it last as long as it can, in which case he has a minor accident, something that you and I would not even call a sprain. He'll have an internal bleed, end up at the ER, have to buy factor, and then use it for 3, 4, 5 days or longer. Now you're talking a lot more money. And in the long run,
Right.
his health starts to deteriorate. Now the insurance company is going to be paying
Right.
a lot more for hospital
why don't they
visits,
think this way?
surgeries. I don't understand it. It's very, and we're talking lower income folks that really need assistance, right? They're also the ones that are going to say, I can't afford it. Here's my rent. Here's food.
Don't touch your lapel.
Oh, sorry. Yeah,
it goes
you're right.
bang.
Oh,
Every
yeah.
time we do that.
Okay.
That's all right.
But my kid will put it off. He'll just say, I could go by another week. And he can't.
The other impact on that too is that level of stress. When my son gets a bill and it says, you owe this $12,000 or whatever, and he's going, well, I can get this copay, but that is not going to affect your deductible. You're still going to owe money down the line to the insurance company. it raises his stress. How is this going to happen? I can't afford it. I just touched my chest too. I can't afford it. So the focus becomes not on how do I get better with this? How can I feel safe? I feel insecure and I have a challenge.
Think about it. So they either put off treatment or they stretch out the medication that they need to manage this condition.
Yeah.
And remember, these people do have skin in the game. They are paying part of this copay. So they're paying their premium. Let's think about this for a second. These are people that have insurance. These are people that are paying monthly premiums, but just need a little bit of help from an outside source to get help paying a copay. These are not people that are saying, we're not going to pay for insurance anymore. These aren't people that are saying, we want free medication. These are people that are paying what they can as part of the copay. They just need a little bit of help from a separate entity.
To live.
Exactly.
And they're being told the help that you're getting from an outside source is fine. You can have all the help you want, but it's not going to count towards your total out-of-pocket costs at the end, and you're still going to be on the hook for that extra money at the end of the year to go towards your maximum out-of-pocket cap. I mean, it's hard to wrap your mind around, isn't it? Truly.
It really is. So we're going to hear this bill in Health and Human Services this coming Wednesday, probably the same day that this will air. Obviously we're not going to exec it. And execing means basically we'll hear it, we'll hear testimony, we'll go through the bill, and then we'll put it in our file and we'll think it over and listen to it and listen to what our constituents say if there's some information. And we have to, including let the insurance companies have their piece, and because we need that as far as making the decision. But as that process goes on, if you're watching this show and you want to make yourself known, check in with the committee hearing. It's Bill 354. And I should know this. I'm a co-sponsor.
Which we appreciate. Thank you so much.
Oh boy, we're juggling a lot of balls. But at the same point, if you want to pipe in, make sure you can send us an email, or you can check in with the committee, or come and testify and listen, or watch live online at the Capitol. That's the beauty of what's going on these days. You can actually watch real time what's going on in committee, so that if you want to learn a little bit more about it, maybe your insurance company is doing the same thing. You might be able to find some remedy. Maybe we can fix it through passing this bill. And there's always that likelihood that somebody might want to try to compromise or try to make an amendment.
Yeah.
And all that information really it affects people directly. So that'll be this coming Wednesday, and in Health and Human Services. Check it out on YouTube through the state website, and pipe up, speak up, and that's why we're here. We want people to know this show really it's national, but we try to have a broad appeal. It's for you to be able to inform others and help others in the process, and it helps us too. As far as hearing from you. But are you going to be there to testify this Wednesday?
I hope to be there to testify, yes.
All right.
Yep.
I happen to be vice chair of that committee.
Then I get to see you again.
I'll be working that day, but my wife Mary is going to be attending, and she signed up to speak as well. And I think maybe Mike can help me out, maybe you even, Senator. Isn't there a way that if people can't attend, they can still submit a written testimony?
Correct. Either through email, or Mike can bring it, or your wife can bring it. And sometimes it's a lot easier. I mean, and here's a little lesson that I like to tell people, because being a chair and vice chair, sometimes people will read their testimony because they're nervous, and that's okay. Don't bring a book.
Oh, no.
Yeah.
Don't bring a book. If you bring a long testimony, submit it, and then capture from your heart the essence of it.
Yeah.
Because that speaks volumes, and we can always read what you said. I get nervous in front of our committees. I really do, especially in the House. There's a lot of faces looking at you, and it can be very intimidating. So if you need to read it, that's fine. But if you're confident in your topic, submit it and talk to your heart from us. because I think in layman's terms, because I'm a layman, I just happen to be a senator, but I like it when people talk to me directly, you know?
Yeah.
And this is for the public to understand as well. So, speak from your heart, and also let us know, how can we fix it? Give me a plan of action, so
Right.
this bill does this, and this is why we like it. And of course, telling your story is very important. It really is.
Yeah.
So,
And I'm betting there are a lot of people out there who will see this
Sure.
program and who will they will relate to it because either they themselves or a loved one or someone that they know is being affected by one of these chronic disorders, and they may have had an experience with an accumulator adjuster, and they know how frustrating it is. It doesn't matter if your mom and dad chip in and pay
Right.
for it. It just doesn't count, and money's money in every other regard. So if it's paid for, it should be paid for.
and I've sat on HHS forever, and I used to sell insurance, and I never heard of this. Years ago, I used to sell.
How
That's a
recent-
relatively newer practice.
That's what I thought, because
Yeah.
I hadn't heard of it either until 3-4 years
Yeah,
ago.
it's a newer
Yeah,
practice.
I think Mary
Isn't that
looked in a
amazing?
little bit and said around 2016 was when some of these policies first started
Yeah.
really
Okay, yeah.
coming to the awareness for people. So it's just another way that the insurance companies have
So
put in.
if people want to get a little bit more informed, Mike, how do they, should they contact you on this topic or anything?
They certainly can if they want to email me at mike.rollo@cancer.org. I'd be happy to get them more information about this or any of the topics that we're working on this year. But I wanted to say thank you to you, Senator, for having us today, and to Senator Innes for sponsoring this bill. We're really looking forward to seeing you on Wednesday.
Yep.
Nice to have a friend. Always nice to be before your committee, but it's always nice to have a friendly face.
We try to make it pleasant.
We're expecting pretty good support. We have 22 out of 24 senators are signed up, and the 2 that aren't on, I did see them in the hallway yesterday, and they apologized. They just didn't get to Concord in time to sign up.
We had a lot.
We're
Believe
expecting
me.
great things for this bill in the Senate. So
Great.
we appreciate
Yeah.
all that
Yeah,
you're doing. Thank
absolutely.
So Mike Rollo from the Cancer Society,
Yes.
Susie and Scott, thank you very much. And by the way, Scott's a musician. So thanks for watching, speaking with the senator, and until next week, thanks for watching.